Hello, my name is Cooper and this is my presentation on X-rays for medical imagery. First, let's start with some background information on X-rays, electromagnetic waves. Electromagnetic waves travel by propagating in a perpendicular direction to the oscillation of the waves. They are made from an electric wave, which oscillates horizontally, and a magnetic wave, which oscillates vertically, giving the name electromagnetic. So, what are some characteristics of X-rays? X-rays are a form of electromagnetic radiation. They have a wavelength between 1 × 10 to the power of -11 and 1 × 10 to the power of -8 meters. They travel via electromagnetic waves, like light but with a higher frequency. They have a frequency between 3 × 10 to the power of 16 and 3 × 10 to the power of 19 Hz, and energy levels between 100 and 1 × 10 to the power of 5 electron volts. X-rays are the second highest energy wave in the electromagnetic spectrum, with the second lowest wavelength. This allows the wave to pass through some mediums, but more dense materials like bone and concrete cannot be penetrated. X-rays can be naturally produced through electrons losing a significant amount of kinetic energy while passing a nucleus. This kinetic energy is reduced as an electron curves around the nucleus after travelling in a straight line, or drops from a higher energy field further from the nucleus to one of less energy that's closer to the nucleus. Now the interesting part, X-rays used in medical imagery. X-ray screening is used to see through skin for diagnosis of bone fractures, some cancers and tissue density. It is a non-invasive way to diagnose, reducing recovery time, and the small exposure to radiation does very little harm. Unfortunately, they cannot diagnose diseases in soft tissue or organs due to the waves being able to pass through them. The production of X-rays for medical imagery. For X-rays to be produced, electrons are shot from a high voltage, positively charged cathode towards a metal target, negatively charged anode, with extremely high energy. During the collision with the target, X-rays are produced and accelerated out of the machine. Now X-rays are used for diagnosis. The machine outputs X-rays towards the area in focus on the patient, like the chest or leg. Some of these X-rays pass through the area in focus without being interrupted by bones or organs too dense to penetrate, and darken a sheet of photographic film behind the area in focus. X-rays that are obstructed leave the area of photographic film white, showing bone and organ locations. This produces an image which can be analysed by a doctor or surgeon to find fractures or cancers. For an example of diagnosing through X-ray screening, I have a short story. Young Jimmy was riding his scooter with Timmy. Jimmy decided to jump down a small flight of stairs, for Instagram of course. Unfortunately, Jimmy's next post was of him sitting in the hospital ward with an agonising pain in his left arm. Jimmy went into the radiology department with Dr. Phillip, who sat him down and conducted an X-ray scan on his arm, which can be seen alongside. Once the film had been produced, Dr. Phillip took the film to Jimmy to show him the results. You can see both of the bones in Jimmy's lower arm have been cracked and shifted to the right. It's a fairly severe fracture that may need surgery to realign the bones. The development of X-ray imagery. The first X-ray scan was conducted by Wilhelm Röntgen between November 1895 and January 1896. It was a scan of his wife's hand. In 1914, Marie Curie developed a mobile X-ray machine called radiological cars for use by battlefield surgeons in World War I. Nowadays, cameras can capture over 4.5 million frames of X-rays every second, allowing for ultra-high definition images of photographic film to be produced. Some benefits of X-ray scanning are the fact that it is a non-invasive and painless diagnosis. They can guide surgeons while performing operations. X-ray scans reduce the need of exploratory surgery, and they can determine if a patient needs surgery. Unfortunately, all good things come with limitations. For X-ray scanning, some of these are minor tissue effects like redness, and multiple X-rays at a young age can possibly result in cancer at an older age, though very unlikely. Thank you for watching, and I hope you learned a little more about X-ray imagery. Bye!